I am Bhupendra Gandhi, Director, Department of Nephrology, Jaslok Hospital Research Center, Mumbai, India. India is placed, incidence of kidney disease is common throughout the world. So India is equally placed like other countries also, but our incidence may be little lesser. The reason for that is our longevity of the patients are little lesser than the other. Incidence is almost 100 to 150 per million population of kidney diseases. Kidney disease is prevalent in male and female in equal distribution, so no sex predominance is there. And incidence of kidney disease is rising in India recently. The reason for this are two. One, longevity of the patients or Indian population is increasing. That is one of the common cause. And other thing is incidence of high blood pressure and diabetes, which are the two common causes of kidney failure, is rising in India markedly. So the incidence of kidney diseases is going up very significantly. Thanks to the government initiative now in helping kidney diseases patients to a certain extent. Previously, kidney disease patients could not afford dialysis, but government has started dialysis units more and more in remote part of India, so the patients are able to get this treatment, though at minimum or at a cost which is high. Issues of dialysis is mostly we should know that once dialysis started in a chronic kidney disease stage 5, patient will require lifelong regular maintenance dialysis. What I mean that once patient goes on dialysis with a CKD stage 5, they will have to go dialysis 2 to 3 times a week, ideally 3 times a week. Dialysis is very expensive in India because most of the insurance companies do not cover dialysis, and government is not helping that much except in the BPL category where patient may be subsidized to a great extent. But most of the common people, middle class people, or who are not above BPL category, they have to pay their own dialysis charges, and that becomes almost 15 to 30,000 rupees per month, lifelong. There are few people can afford this type of treatment in India. That is the most common cause, and incidence of complication with the long-term dialysis are numerous, mainly cardiovascular diseases, hepatitis B and C virus, which is fortunately getting under control, neuropathy, and this occurs more and more frequently in the patient with long-term dialysis. Latest development of dialysis in last few years' time is availability of vitamin D, which helps in correcting bone problems. Availability of erythropoietin injection, which maintains the normal hemoglobin, that makes the quality of life far better than life used to before. And now is not available still in India, and also available at very few selected places, is what you call wearable artificial kidney, where patient can wear this kidney like a belt and can carry on the work and like normal person, and this is now in stage 3 and 4 stages in USA and likely to be available in next few years' time. This will be the biggest advantage for the patient with chronic kidney disease stage. Organ transplantation in India is started much later, which is catching up. India, we do mainly live-related donor transplantation. The reason for this is patients with kidney diseases have two ways of survival: lifelong dialysis, I told you the problems, and transplantation. Transplantation abroad is very common because they get deceased donor transplantation or cadaver transplantation, which is the most prevalent in the Western world, where 50 to 60% of the patients are getting cadaver transplant, and government subsidizes dialysis or give free dialysis till the patient gets transplantation. But India, we do have problem, as I mentioned before. Number of dialysis centers are few. Patient cannot survive long because they go for the transplantation quickly, and only way they go for the quick transplantation is from the live related donor transplantation, where either their father, mother, brother, sister, children or wife or the spouse give the kidney. This is the best way, in my opinion, for the chronic disease patient to survive, because quality of life and quantity of life is far better with a successful transplantation than life on dialysis. With availability of the newer immunosuppressant medications like mycophenolate mofetil, CNI inhibitors and induction therapy, survival of the transplantation is 90 to 95% at the end of 1 year, and at the end of 5 years also it is 70 or more than 70%. So that, in my opinion, patient with chronic disease, kidney disease, best way to survive is go with a transplantation. In this scenario, what I would like to stress one thing is, in India, if with the nuclear family coming up in the picture now is more and more, so the availability of the live related donor transplantation is getting fewer. We will have to mobilize our medical fraternity and public education to see if we can get a cadaveric or deceased donor transplantation, and if we are successful in getting deceased donor transplantation, and as you all of us know that we are a lot of accident cases are occurring in India, if we can harvest the kidney or the organs, we can get a lot of patients can survive with a cadaveric or deceased donor transplantation, and this is the best way to go, in my opinion. In organ transplantation, the most important challenge is to prevent the rejection of the transplant kidney, which is, as I told you before, with the availability of the newer medication, much lesser than before. But the biggest challenges are two. Incidence of infection is higher with the transplantation because we give immunosuppressive medication to these patients. Immunosuppression medication decreases the resistance of person's body to prevent rejection or fight the kidney. That also suppresses the body resistance power to fight infection, so that they are susceptible to infection, mainly the viral infections, TB and bacterial infection. Incidence of infection is higher in the first 3 to 6 months, so they have to be extremely careful about getting the infection in the first 3 months. After 3 months, the dose of medication is reduced considerably, so that chance of getting infection is much lesser, but they have to be careful throughout their life. And other thing which I would like to stress over here is very common reason for we are losing kidney after 1, 2, 3 years is patient's non-compliance. Patient feels that I am doing well with the transplant. Doctor has advised me 3 tablets, I can get by with 2, 1, and they stop the medication. Non-compliance patient, ultimately they develop rejection, so that the incidence of rejection after 2, 3 years is common in India because patients not able to afford it or they do not take the medication as suggested. This is and other thing which we are facing problem now. Incidence of cancer is rising in transplant patient because of our immunosuppressive medication, but it is not that common because we are using less and less amount of immunosuppressive medication. But we have to be vigilant about the cancer incidence in transplant patients. I think patients with kidney disease initially had a very bleak features. They used to survive, but their quality of life was much poorer. With the availability of good dialysis facilities, erythropoietin injections, and vitamin D, and better quality of dialyzers, quality of life on dialysis also is good. Quality of life also has improved significantly after the transplantation, and I think we are making progress so that successful transplant patient can have a near normal quality of life after 3 to 6 months of transplantation. So in my opinion, kidney disease patient can fight kidney disease with dialysis as well as transplantation, but transplantation is a better choice because of quality and quantity of life is far better. Thank you.